Hi, I'm Melinda Taschetta-Millane, Editorial Director of Imaging Technology News, and we are here today at NCoBC with Dr. Barbara Rabinowitz, who is the founder of NCoBC and also psychotherapist and sex therapist. So welcome. Thank you for being with us here today.
That's not soon enough.
And Dr. Rabinowitz is going to talk with us today about survivorship. So, Doctor, what do people generally understand when we talk about survivorship?
People are not sure when they hear survivorship. Do I count? I'm still in treatment. Or do I have to wait till after I finish treatment in order to count myself as a breast cancer survivor? And the national definition says from the moment of diagnosis forward, a person is a breast cancer survivor, no matter what stage they are along that pathway. We try and get that message across because there are so many resources, materials, and education that can be made available if people know they count as survivors.
When did this whole survivorship conversation get started?
That's interesting. It was nameless, and we all sort of tried to make sure we made resources available to patients all through the process that they were going through, the walk that they were walking. But in 2005, the National Institute of Health put out a monograph called From Cancer Patient to Survivor, Lost in Transition. That was a wake-up call to the entire healthcare community. We may think we're doing a good job, we're not doing good enough. And they laid out what needed to happen and what were the issues that needed to be addressed, and that we in the healthcare community needed to begin to see survivorship as a distinct phase of care. Give it a name, give it a face, get information out there related to it.
Great, great. And how do you think that we as a community are doing to meet these survivorship needs?
That's a good question. It's variable. There are some places that are doing fabulously well in having survivorship activities for their patient survivor populations, others not so much, and so there's still a lot of work to be done. However, for instance, the National Accreditation Program Breast Centers, we created a standard. So they have to meet all these standards. Now there's a survivorship standard that breast centers need to meet in order to get accredited. Here at the National Consortium of Breast Centers, we dedicate one full day to survivorship and then many pockets during the course of the main meeting to survivorship. We'll continue pushing because this is an issue that cannot go underground. It's really important.
That's wonderful. And if people want more information, where can they go for that?
Right. So there are some websites that are really good at addressing survivorship issues. Breastcancer.org, great in doing it. Also, the American Cancer Society has some good information on their website about survivorship. Komen.org, good information on survivorship. So when they go to these websites, specifically go to survivorship. And I want to tell you about one new one that's just coming out now that is like a community for breast cancer survivors called medicope.com. It's changing its name right now to Wisdo, WISDO.com. So look it up under both because they're creating like a Facebook, but for a breast cancer community alone. It's very exciting. It's coming down the pike. There are good resources out there.
Great. Thank you so much for your information. We appreciate it, Doctor.
My pleasure.